important, wonderful relief. Leprosy is curable. Leprosy is touchable, not untouchable. So a lot of work had been done by the social activists on this important area, which is otherwise was carrying a lot of social stigma in the ancient India. Now let us talk about keratocanthoma. Typically there is a rapid growth of a crater containing lesion which will regress, which will involute with the scarring is the description of the keratocanthoma. Why do you want to remember about this crater and why does it bother you? Because squamous cell carcinoma also looks like the twin sister of the keratocanthoma. You have to be very sure. It carries a bad prognosis, keratocanthoma has good prognosis, only it is a histology which is going to give you one important clue. Now let us talk about erythema nodosum. What do you mean by erythema nodosum? There is a lot of subcutaneous fat which is there underneath the skin. It is the inflammation of the subcutaneous fat which is called as erythema nodosum is what you need to basically remember. So how do I like to describe it? There will be raised lesions, erythematous lesions, very painful in nature because it is the inflammation of the fat, and it is found on the anterior part of the shin is a typical area where erythematous nodosum will be developing is what I want to underscore to all of you. Now can you tell me, doctor, what are all the systemic conditions which you need to think of when you see the erythema nodosum lesions on the skin of the patient? Think of possibility of any tuberculosis or leprosy in this part of the world. Take a careful drug history. Sulfonamides can lead to a drug reaction which can be erythema nodosum like picture. Sarcoidosis can lead to skin lesions in the form of erythema nodosum. Streptococcus can cause infection of the subcutaneous fat leading to erythema nodosum. And coccidomycosis is another important. So all these systemic conditions should be kept in mind tomorrow when you come across a patient who has got a erythema nodosum, which is a raised erythematous painful nodule on the shin, is what I want to underscore to all of you. Now you can see how this raised nodular erythematous painful lesions which are found in the classical site on the shin, you are not going to forget about the erythema nodosum. Now also you need to remember that it is basically the inflammation of the subcutaneous fat. If you take the biopsy, what you come across is that fat which is there beneath the dermis, subcutaneous area, is the place where typically you find inflammation. Paniculitis is equal to erythema nodosum is what I want to underscore to all of you. Now let us talk about the various malignancies of the skin. Ultraviolet light is the common cause for all the malignancies of the skin. Three major malignancies: basal cell carcinoma, squamous cell carcinoma, and the malignant melanoma. Let us talk about basal cell carcinoma, which is the most common malignant tumor of the skin. It is the sun exposed areas which are exposed to ultraviolet light. Hair bearing surfaces are the ones which develop basal cell carcinoma. What is the difference between basal cell and squamous cell? Basal cell is locally aggressive and it is only locally infiltrating lesion, and it is the basal layer of the epidermis, stratum basale, from which this basal cell carcinoma is arising. Good news is it does not metastasize. Now what are the common locations that you can come across this lesion, doctor? The face, on the inner aspect of the nose is one important area. Around the orbit is second important area, and on the upper lip it can arise like a nodule. Why you want to remember about upper lip and basal cell carcinoma is, basal cell carcinoma and squamous cell carcinoma differ romantically, doctor. Basal cell carcinoma loves to have upper lip. Squamous cell carcinoma typically involves a lower lip. So this is the major difference in the distribution is what you need to basically remember. So now you can see how the upper lip area is the one which became involved with the basal cell carcinoma. And typically the external surface of the basal cell carcinoma, if you like to describe that nodule, it will be pearly colored, prominent vascular channels will be visible beneath the surface is the typical description of the basal cell carcinoma. How will it be appearing microscopically? When you look at it, is a typical stratum basale of the epidermis from where this basal cell carcinoma is arising. That's the reason you find a lot of basophilic staining cells at multiple locations along the basal cell layer. They will be infiltrating